Okay, now I'm going to tell you why you need to take control and learn these things yourself, for yourself, your kids, your grandkids. Raise your hand if you've read or you've heard that your kids or grandkids are not going to live as long as you have. How many of you have heard that? It's in the news almost every day now. It's in the news almost every day, and it's gathering some steam because they did this study on a bunch of kids out of Columbia, Missouri, my old alma mater, University of Missouri. They looked at kids between the ages of 8 and 15. They just did ultrasounds on their carotid arteries in their neck. And although they were chronologically age 8, biologically they were 50 because their carotid arteries in their neck were clogged at the same level that a 50-year-old's arteries are clogged. That's because they're living on French fries and Pepsi-Cola and Coca-Cola and fried chicken and Captain D's fried chicken and McDonald's French fried potatoes and all that kind of stuff. No vitamins and minerals. It can be a terrible thing to bury all your kids and grandkids. And so we're going to have to be proactive here if we're going to turn this around, because the government's not going to do it, the doctors aren't going to do it, certainly the pharmaceutical companies aren't going to do it. This is a big study that was done by the Harvard Medical School, Dr. Lucien Lepay. I love that guy. This came out in November of '96. Examining the casualty count, the annual toll of medical harm in American hospitals inflicted on American patients by American doctors. 1.3 million physical injuries and 180,000 killed each year in American hospitals. This was back in 1996. In 1999, 3 years later, this came out. Medical mistakes moved up to where they were the 8th leading cause of death. The 8th leading cause of death in Americans in hospitals is doctors. Behind cardiovascular disease, cancer, diabetes, Alzheimer's disease, gastrointestinal problems, liver problems, and doctors. Then, at Johns Hopkins School of Hygiene and Public Health, which is a department of the medical school there in Baltimore, Maryland, doctors are moved up to the number 3 leading cause of death in American hospitals. This was December '02. So in 3 years, they went from being number 8 to the 3rd. They've improved. They moved up from number 8 to number 3. Okay? This was published in December of '02 in JAMA, the Journal of the American Medical Association. These total 250,000 deaths per year from iatrogenic causes. The word iatrogenic, you can look it up in any medical dictionary. It means deaths and injuries caused by doctors. So if you have a death certificate of somebody you love or a relative that says cause of death, iatrogenic causes, it's not a genetic disease, it's the doctor killed them. Then this just came out even more recently. Annual mortality, meaning deaths in Americans here in the United States. This is hospitals and in private offices and clinics. These are people who are killed by doctors. These people didn't go to the doctor's office to die. They went there for some minor little thing, and they had an earache, or they went to the hospital to deliver a baby, or they have a hangnail dealt with, and the doctor killed them. 783,000, almost 784,000 every year in America. According to the Center for Disease Control of Atlanta, Georgia, 2 million Americans are infected each year with MRSA and all these other bacteria and things. 100,000 die. A hospital is a dirty, filthy place. Doctors don't wash their hands after they go pee-pee and poo-poo. They just don't wash their hands because they're too busy. This is according to the Center for Disease Control of Atlanta, Georgia. This is not me. I'm just a reporter here. Oh, Dr. Wallach, you're so rude. You're so mean to those doctors. Well, I couldn't report this if they didn't do it. Clean up their act, and then I can't say anything bad about them, right? When it comes to drugs, deaths by medication errors rising, mistakes tied to 1.5 million fatalities. Drugs every year. I think there's only 50,000 a year that die from street drugs. That's wonderful. Fatal drug mistakes up to 700% in 20 years. Up 700% in 20 years. Oh, the FDA is doing a good job protecting us. Now, this is the most beautiful thing I've ever seen. This was February 2007, just about 2 years ago now. And the information in here came from the Journal of the American Medical Association, Center for Disease Control, many health institutes. They said 15 million instances of medical harm inflicted on American patients each year by medical doctors in America. 15 million a year. How many of you heard that story? No, I don't see any hands. And that's because at that time, this was the only article that had that in there. This never appeared on any TV news thing. Sanjay Gupta didn't say it. Okay? This never was on any radio program or any other newspaper or magazine, because this is the time at the peaks of the stories of Anna Nicole Smith. And everybody wanted to know about Anna Nicole Smith, or whatever her name was, and who, of the hundreds of men who claimed they were the father of the child, who was it? Oh, you got to put things in perspective, right? Then the FDA started recording adverse reactions to vitamins and minerals. When you take too much vitamin C, you get diarrhea. So they wanted to know how many people were complaining of diarrhea from too much vitamin C. In the first 6 months of 2007, there were 600 adverse events, no deaths. Okay? And they're just talking about diarrhea, vomiting, that kind of stuff. At the same time, during the same period of time, FDA took in 482,154 adverse event reports for prescription drugs, of which half of them were deaths. Well, you see, here's this story down here in the lower right-hand corner in fine print. Look at the headlines. Whoa, must be dangerous. People pay a lot of money to get a cleanse. And the FDA calls it an adverse event.